Thank you for joining us and welcome to Better Together Live, where we create helpful community connections when it matters most. My name is Yamile Bowman. I'm your host and the Community Relations Coordinator here at TherapyWorks. And today I'm very, very happy to be joined by Julie Muccini. Am I saying your last name okay, right? Yes, I am. I know you for a long time.
Of course.
Julie Muccini. Julie is an occupational therapist and also works with people with functional neurological disorders. Julie, so we started, welcome, by the way. Thank you so much for being here with me today. Absolutely. We started Better Together Live to highlight local resources like you to offer more, for our community, to offer more information out there. So thank you so much. And you still there? Oh, good.
Yeah, I'm here. Can you hear me?
Yes, I'm so sorry. Before we start with my set of questions, Julie, can you tell us a little bit about yourself?
Sure. So I'm Julie. I'm an occupational therapist. My first degree was in industrial engineering and operations research, and I went to Boston University for a master's in occupational therapy. And I started and provided occupational therapy services in many different environments, inpatient, outpatient, some skilled nursing. I've done some home environment work, and I did a short stint in a school district, but primarily my focus has been inpatient hospital and then the rehabilitation clinic working at Stanford Hospital and Clinics. And Stanford Healthcare, And my recent job is now working at Stanford University in the Human Performance Lab, and then working with some private patients on the side. So that's me.
That's incredible. You've been doing this for so long. That's incredible.
Long time, 24 years. Yeah.
Wow. That's great. Thank you. What is the role of an occupational therapist?
Okay, so an occupational therapist is one of the disciplines of rehabilitation. So there are occupational therapists, physical therapists, and speech therapists. And we each have our own professional organizations, our own level of certifications and registration and licensure. So at occupational therapists, we work with individuals to promote functional independence with what we call, the jargon is activities of daily living or instrumental activities of daily living. So what that means is your dressing, bathing, hygiene, grooming, eating, basic activities of daily living and toileting. And then instrumental activities of daily living include things like driving and shopping, cooking, home management, work, leisure activities, community access. So the key is, as an OT, we're promoting that functional level of participation, meaningful occupation in all ways possible, and any way that helps you be efficient.
Sort of independent.
Effective. Yeah, independence, basically.
Yeah. Wow. Who benefits from your services? I mean, are people who had into head trauma, accidents? Who?
Yeah, excellent question. So actually OTs work with the range of humans. So there are OTs that work in the infant ICU where babies are just born and they have difficulties with managing their ability to eat. So there are OTs that work with infants just born. There are occupational therapists that work in school environments with young children with their fine motor and their ability to engage in their play and writing tasks. There are OTs that work with teenagers for those issues as well, and some for mental health issues. And then we have OTs that work with adults. I work with adults.
Okay,
and
18 and over, correct?
Yeah, all the adults. So I work with adults, but there's a whole realm of OTs that just work with pediatrics.
Right.
And so everything from all physical disabilities to all emotional and mental health issues. Like, an OT can work with every human.
Yes, you can, especially you, woman. Absolutely. What are the core skills of an OT?
I know, it's when I saw the question, I thought, this is such a good question. So, I mean, I think with an OT, you have to have exceptional communication skills.
Absolutely.
You have to be able to communicate and relate with individuals to gain their trust so that you can facilitate their efficacy for recovery, or maybe not recovery. Some patients are only on a downward trajectory, but like exceptional communication, really good personal skills, excellent observational skills, for whatever they're going through, that you're observing how they interact with their environment, where they're being independent, where they need facilitation, observation of the personal interrelationships with their family, physical strength. I have a lot of patients with significant disability that really need strength, for me to do handling techniques to facilitate their recovery. You have to be organized. You have to be really patient. Sometimes it takes 45 minutes to get up from the wheelchair and transfer over to the toilet.
Oh, wow. You do have to be very patient.
Really patient, and just you just have to be a good cheerleader, right? Just provide that motivation and emotional support as these individuals are really struggling with some new permanent disability, or knowing that, they have a terminal illness, and we're just trying to maintain their dignity, they.
Yeah, and knowing you, Julie, they are in the best hands. You are absolutely wonderful. So thank you for all that. Absolutely. Yes, yes. Do you need, when you're working with a client, do you need to change their environment?
Yes, yeah, definitely.
So you have to go to their home and kind of like apply, okay.
Yeah, exactly. So, sometimes I'm not always the home therapist, but there are therapists who specialize in home care.
Okay.
And, again, you're trying to facilitate that person's functional independence. So whether it's home modifications or adding new equipment, or so basically it's really making the environment accessible. And that also goes from a psychological perspective. So it's not only like, okay, move the coffee table, make the door wider, take off the shower glass door. Part of it is also like, hey, how can all the dynamics of everyone providing support, how can we also alter this? So like, we even train family members how to cue patients so that they can be more successful. So it's modifying the interactions, and it's modifying the environment.
And their mind, in a way, right? The way they see, people with some disabilities is you have to modify all that.
Absolutely.
From the inside, right?
Exactly.
How does your clients' mental health influences in their recovery process?
So this is an excellent question. So, an individual's, you would call perception of self-efficacy, an individual's perception of, or their resilience, I, in my 24 years of experience, that does play an enormous role in improving outcomes. And again, not all my patients are getting better. A large percentage of my patients are only declining. They have terminal illness. This is a disease that's not going away. So, knowing their level to embrace and accept the what's happening, the symptoms, changes, it really does make a difference in how they continue engaging with their family, with their home, participating in leisure, engaging in meaningful occupation. So, it really does play a huge role. Yeah. And if individuals after, for example, a stroke, most of those individuals will experience a level of depression. And so how can that best be managed to facilitate, the chances of a person having some type of recovery and regaining some of their functional independence again?
Right. It is very, very, very important. Yeah.
Really important.
Can you talk a little bit about the functional neurological disorder, what it is?
Yeah.
We kind of talked in the beginning.
Yeah. So it's known, now we call it functional neurological disorder. It is known previously as conversion disorder. So basically, that's what it, a lot of clinicians will understand if you say conversion disorder. So basically, the individuals with this are experiencing movements or events that are not in their control.
Okay.
So whether it's a movement disorder or they're having what we call a psychogenic seizure. So it looks like a seizure, but when you monitor them, it's actually not a seizure. Okay. Or you look at this individual and it appears as though they have weakness on one side or a tremor, but basically their brain is doing these things and they're not aware that they're doing it. So they're not, the key with functional neurologic disorder, they're not faking these things. These are really happening. But when you do an MRI and you go through all the testing, because only officially a neurologist can diagnose, to give the final diagnosis of FND, they will show in the MRI or muscle biopsy or EMG or all the ways of testing that, in fact, everything is intact. Brain is intact, musculoskeletal is intact, but there is this extra movement or this something that is causing this extra, atypical pattern of movement. And so that's really what it is. It's just these extra movements or these seizures that are not really in your control. But there's no like organic cause.
Okay.
Not to say that you can't have a stroke and you can have FND, because there's movement disorders that are, or patterns of movement that are caused by a stroke, but the ones with FND are different.
Oh, different. Okay. So can we say that FND is a mental disorder in a way?
Well, the treatment, so it's hard. I always get a little stuck with, I'm sure other physicians who would say, give you a more precise answer, but I feel like there is a component, because the best outcomes are patients who do work with their neuropsychiatrists. The patients who have best outcomes work with the rehab team, and they do best when they have cognitive behavioral therapy and dialectic behavioral therapy. Like, those outcomes are better. So there is a component where working with your mental health professionals, you have a better outcome. So I suppose in a sense, it is a mental health condition, but it also has a very, like neurological.
Specific neurological, which that's where you come to.
Exactly.
Yeah. And is this FND, is that progressive?
Well, if it's not treated, it can be. So, for example, if you never get it diagnosed properly, some people live their whole life with this FND. Some people, for 9 years are waiting for it to be finally diagnosed, and then they get it diagnosed, they accept the diagnosis, and then they can make a nice recovery. So, but if it's not treated, if the patient is never told this is FND, we actually can help you get better, then people will continue to get, weaker. The tremor will be more significant. Because they're not using that side, it will in fact get weaker. They'll have more episodes of these psychogenic seizures. That's disabling. You lose, ability to interact with family. So it can continue to really have a negative effect on your ability.
Right. And that was going to be my next question. What are the symptoms? But you're kind of like saying it already, right?
So the symptoms officially are weakness or paralysis. So difficulty moving a body part or walking, abnormal movements, which is like stiffness, shaking or jerking, difficulty swallowing. So our speech therapists work with a lot of these folks. They can have difficulty swallowing, changes in speech. They'll be slurred or soft speech. They'll be stuttering. You'll have these psychogenic non-epileptic seizures. You'll have abnormal sensations, numbness or loss of feeling. You'll have sensory changes, so difficulty seeing. So we have the neuro-ophthalmologists work with patients who they have this functional blindness, but it's all FND.
But it's all FND.
Difficulty smelling or hearing, or a combination of all of the above. So it's quite complicated, right? Because you're I have numbness, I have weakness. So you see the neurologist and they're like, there's nothing on the MRI. Your CMT, your everything, the EMG, everything's intact. And so then it takes a long time to finally rule everything else out so that you can give the FND.
And is that an age specific? Does this happen to
I've worked with there are children who have it. I've worked with teenagers. I've worked with adults. I think there's a certain level of age. There's a certain age limit. I don't know how young the youngest child is. I've only heard of children like in middle school affecting them.
So
I've never known it in the like elementary, but not to say that doesn't happen.
Got it. Wow, this is incredible information, Julie, and I want to be very respectful on your time, but is there anything else you would like to add to this? The floor is yours right now.
If it's, That's a good question. You know, I really feel happy and proud that, you know, there is someone who's experiencing FND, for example, that they're, you know, to seek out your mental health providers, but most importantly, to work with your neurologist to get the final diagnosis. And just to say, once the individual really does have to understand and accept the diagnosis for there to be a good outcome.
A good outcome, yeah.
And so
and
that
acceptance will be, you know, for all of us, is a hard thing, right?
Exactly.
When it's something's going to change dramatically our life, the way we live, and that's where we come, right? The mental health, you know, community to just help these people. Yeah.
But the good news is, you know, I've had some wonderful cases where individuals come in and they have accepted the diagnosis. We do special techniques in clinic to show the typical patterns of movement. We show them the videotape. It's amazing. They see what they're doing all of a sudden. And in one session, sometimes I've walked out with an individual and put their walker in the trunk and be like, okay, we're done. Yeah. So, you know, these patients, it's important to know with FND, you can make a complete and full recovery. And that's the good news, 100% recovery. So it's really good to get the treatment.
That's great. Thank you, thank you, thank you. Julie, if somebody wants to connect with you, can you share your information with us?
Yeah. So probably the easiest thing is just Julie Muccini. So you can see, is my name showing up on
Yeah, it is. Yeah.
Julie Muccini at yahoo.com.
To get information.
That's the easiest way to reach out. And, you know, if you have any questions or want to get some other guidance, by all means, reach out.
Absolutely. And thank you again for being here with us. And again, for us in Therapy World, our philosophy is very, very simple. We are better together. And everything we do is in support of our community. And I know some people that are not ready to take the first step for recovery. But when they're ready, we are here to help. If you guys want to learn more about us, visit mytherapyworks.com. Julie, thank you so much for your time today. And I can't wait to do this again. We have to.
Yes.
So thank you. I appreciate your time. Okay. Enjoy your day.
Okay, you too.
All right, I'll talk to you later. Bye.